My number one takeaway is don't use anything that's scented, has chemicals or glitters or scents or, you can rinse this part of your body with just water and it's fine. If you want to use a wash, make sure you use a pH balance specific vulvar wash. But, genitals don't need to smell like coconuts. Like it's fine to just use water. But I also want people to know that like there's no quick fix for these issues. You can't sit on a vibrating chair that does 30,000 Kegels. You can't just insert a laser wand for 3 months and expect long-term results. It's just like exercise. You have to put in the work.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to be speaking with an expert on a topic that we don't talk much about, but I think it's a super important topic that a lot of people are going to be interested in. Her name is Dr. Sara Reardon. She has been practicing as a board certified pelvic floor physical therapist for over 18 years. She's the founder of the V-Hive, which is an online pelvic floor workout app for pregnancy, postpartum, menopause, painful sex, and pelvic floor strengthening, which is actually important for both men and women, as we'll discuss, especially for people who have frequent urination and things of that nature. We'll definitely be jumping into a lot of important topics that apply for both men and women. She has hundreds of thousands of followers as the Vagina Whisperer on Instagram and TikTok, and is the author of the national best-selling book called Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage. Dr. Reardon, thank you so much for joining us today.
Thanks for having me.
All right. Well, yeah, this is such an important topic. Let's maybe start with a brief background of how you got into this work and what are some of the reasons why this is such an important field that not many people are speaking about.
Right. So I have been a pelvic floor physical therapist for over 18 years, and I started my career as a PT right away. It used to be called women's health, and now we call it pelvic health because we do treat all genders. And when I was in graduate school and physical therapy school, I remember taking a couple weeks of courses about the pelvic floor and thinking, oh, no one's ever talked about this before. Like I've taken anatomy and physiology before, and this feels really important as a woman to kind of better understand this part of my body. And then I started treating patients in this when I was doing my training. And I thought, oh my gosh, there's so many people suffering and no one's talking about this. And these are muscles like any other muscle in your body. So as PTs, we can treat them with movement and breathing and stretching and strengthening. And yet it affects women's and men's quality of life so much, from being able to exercise, become sexually active, feel confident in their bodies, travel, take care of their families. So I just really love this field because I'm very comfortable talking about the pelvic floor and the vagina and the genitals. And I think it's something that we're never taught about and we don't even realize it exists until often we have a problem. So I'm happy to be here and really talk about these things that I think people really need to know.
Yeah, I think it's super important. I mean, let's start with what are some of the biggest issues that you see people having when they have issues with their pelvic floor, when they've never strengthened their pelvic floor, they've never I
Right.
mean, even me, I've been working out for, I don't know how many, 30 years, and I don't think I've ever done any pelvic floor exercise. I've heard of Kegels, heard about these things, Kegels, that I should be doing, but I don't really know much about them. So maybe we'll talk about that. But let's start with what are some of the most common issues that you think could be attributed to not having a good kind of pelvic floor strength?
The narrative for anything related to the pelvic floor has been do Kegels. Like you want better
Mm-hmm.
sex, do Kegels. You want, good core strength, do Kegels. You want to stop leakage, do Kegels. But Kegels are one exercise. It's one contraction and it's for strengthening. But it's just like any other exercise. You can't just do Kegels in the carpool lane and expect your pelvic floor to be in tip top shape. Common issues related to the pelvic floor typically have to relate to bladder health, like a hard time starting your urine stream, incomplete bladder emptying, a slow or weak stream, or urinary leakage, which we often, know women experience with aging. Sometimes men experience it after a prostate procedure or surgery. So that's like hands down the most common issue is urinary leakage. Other issues are bowel health issues like constipation, fecal leakage or staining in the underwear, hemorrhoids, fissures, fecal urgency. Also sexual health. So painful intercourse, premature ejaculation, difficulty maintaining erections, difficulty having orgasms. So that affects all genders. And then even things like back pain, hip pain, pelvic pain, vaginal pain, or penile pain. the muscles in this area support your pelvic organs like your bladder, your balls, in the male the prostate, and the females the uterus and ovaries, but they also have the openings for urine to exit the body, stool to exit the body, and then in female bodies the vagina for intercourse, menstruation, and birth. So anything in this area that is a problem is likely involving the pelvic floor muscles, but we don't really talk about them or even know that they could be a culprit when we're experiencing symptoms.
Yeah, I mean, let's start with urination, right? And frequent urination. And even, for example, is it, I feel blessed at the moment, knock on wood, unless I drink a ton of water at night, I can sleep through the night without having to go to the bathroom. Most people I talk to in their 40s and beyond can't.
Right.
And they have to wake, so I've heard of people who have to wake up 2, 3 times in the middle of the night. Is that normal?
Yeah. What's interesting is we're never taught what's normal. So the
Yeah.
normal frequency to pee is every 2 to 4 hours during the day and
Mhm.
0 to 2 times at night. So if you wake up once, maybe twice, then that's considered normal. But if you're waking up more frequently than that, that's out of range of normal. What can happen is a few things. As the bladder fills, it's like a deflated balloon that as it fills, it kind of starts to stretch. And as it gets fuller with urine, it sends a signal to our brain that says, hey, I'm getting full. I'm going to have to empty soon. And then your pelvic floor muscles kind of tighten up, hold all of that urine in your bladder until you can get to the bathroom. And then you relax those muscles to empty. If your bladder is overly full, oftentimes, like we call it a boggy bladder or a weak bladder, it can't push the urine out well because your bladder is actually a muscle. If your pelvic floor muscles are too tight or tense and they don't relax well, the bladder, even if it's pushing, may not be able to overcome that urine, that resistance, and you can have incomplete bladder emptying or urinary tract infections.
Mm.
Or in male bodies, as the prostate can enlarge with aging, the way the prostate enlarges is from the outside in. So it's like a donut, and the whole of the donut starts to get smaller and smaller. So with aging in males, that prostate starts to get kind of clamping in on the urethra, and then you don't empty your bladder as well, which makes you feel like you have to go more frequently. The challenge is that people, when they can't pee, they start pushing. And pushing when you pee can actually cause pelvic floor problems. So it's important to know how to pee properly, how frequently you should be going. So if you're not doing those things, you're like, oh, maybe I do need to see a urologist or a pelvic floor therapist.
Yeah. I mean, and then as we get older, and you hear about people wearing adult diapers
Yep.
and things like that, I know it's a big fear of many people of, as they get older, oh my gosh, I don't want to have to wear an adult diaper. Is that, and obviously there's many different reasons of why that could happen, but, in general, if you do pelvic floor exercises, become aware of it, let's say read your book, actually take this topic seriously, is that something that would help potentially avoid that issue as you get older?
Absolutely. I mean, I think one of the biggest challenges in pelvic health is that we've normalized leakage with age. And it's definitely more likely with aging. Your muscles get weaker. You have less estrogen. You have less testosterone, which can weaken the pelvic floor muscles. You have less muscle tone. But also for female bodies, pregnancy, birth, and menopause are the three biggest risk factors for developing a pelvic floor disorder. So when we're going through those huge transitions physically in our lives, we should be getting pelvic floor therapy because we know we're at risk for developing an issue. Go see a pelvic floor therapist during pregnancy. Make sure that you see one 6 weeks postpartum for follow-up. When you're in perimenopause even, you should be working on pelvic floor exercises to make sure that you're building muscle strength in this area, and then definitely postmenopausal. So over the age of 65, 50% of women leak urine.
Wow.
1 in 2. And
And
you're
that would be like just in random moments or when they laugh or some.
anything. It could be
Uh-huh.
with a cough or a sneeze. It could be with
Uh-huh.
exercise. It could be with an urge to get to the bathroom. But these symptoms don't get better with age. So because we're not recommending pelvic floor therapy, when these little leaks start to happen, they start to become bigger and more common and more frequent. And then we end up in full-blown diapers. So I'm huge on proactively getting women help and men. And then also, if you've even experienced this for years, it's never too late to start getting help and start doing exercises.
Yeah, yeah, absolutely. I mean, this is a huge thing as we get older, your quality of life. I mean, it's really sad to say. I've even heard of old people taking their lives because, they just, they're used to being healthy and operating their lives as normal, and the next thing you know, they're wearing a diaper and someone's got to, help clean them up, and they just can't deal with it. It's a
Yeah.
really sad thing as you get older. So, to know that there's actually things we can do to prevent this, just like things listeners have heard many episodes where we talk about things we can do to hopefully prevent dementia and other
Right.
issues. This is another one that has a huge impact on your quality of life. Like you said, 50% of women over the age of 60, leaking, when that's something that could be solved. So let's maybe talk a little bit about, like, so someone's listening, maybe someone is over 60, maybe someone is leaking, and they're listening to this and they're saying, oh my gosh, I've never heard anyone talk about this. Where should I start?
Yeah. And, I think the first step is understanding what's normal and understanding what this muscle does and how it works. So, in the very kind of first few chapters of my book, I talk about, like, what are the pelvic floor muscles? We've never even learned about them. We don't even know if we're contracting them right or relaxing them right, or if we need strengthening or if we need stretching. So I think the most important piece is knowing that it exists, understanding what it does, and then determining, do I need relaxation and I need to focus more on stretching and breathing, or do I need strengthening? And then I walk down the path of, yes, Kegel exercises, but also bringing this muscle into function. And it's kind of like if you have back pain, you just can't tell somebody to do crunches, right? You have to look at their posture, how they're moving, their hip mobility, everything. So that's kind of what pelvic health is that we need to think outside of just doing a Kegel and really help people get a much more kind of individualized approach. So you can see a pelvic floor therapist in person. There are telehealth sessions, my book, my online program to help you determine, like, where do I start? And then also the simple everyday things you can do at home, like make sure you're not pushing when you pee. You should be relaxing, keeping your bowel movement soft and using a squatty potty to have empty your bowel so you're not straining, exhaling when you're exerting effort during workouts so you're not pushing out on your pelvic floor. So different, like, small things that are really easy to implement but can really make a big impact in your life.
Yeah, let's dig into those a little bit. So why is a squatty potty so important?
If you're not using one and not familiar with it, a squatty potty is a step stool that you put under your feet when you're having a bowel movement. And the reason we do this is, historically and in other cultures, squatting is the best position to relax the pelvic floor for a bowel movement. But we even see this when women are giving birth. They're lying on their back and their knees are pulled towards their chest, which is a squatting position. If you go to Asia or other countries, they squat over the ground to use the bathroom, because squatting helps best relax your pelvic floor. And your pelvic floor is what keeps in urine and stool. So if you can squat to relax for a bowel movement, it, like, unkinks the hose of your colon and then allows stool to kind of pass through easier. The reason this is important is because straining during bowel movements can weaken your pelvic floor more than running, jumping, coughing, sneezing, doing crunches. So if you're having a bowel movement every day and you're straining, that's going to weaken your pelvic floor. That can lead to leakage, that can lead to prolapse. So it can lead to a hernia. So you want to make sure that you're doing this properly and really effectively.
Yeah, and so you mentioned some other things like running and things like that can weaken your pelvic floor.
So a couple of things, not weaken it, but it can put impact on it. So say you're a person who every time they cough or sneeze, they leak urine, and they're like, oh, this is a big problem. And then say you do a bunch of strengthening, but if you're straining during bowel movements, you're kind of doing the opposite of what can help strengthen your pelvic floor. So it's always thinking about, what do I need to start doing, but also maybe what do I need to stop doing that led to this in the first place.
Okay, so squatty potty helps, and then not straining, obviously. I also heard you say that you're a big fan of bidets. Is there a reason for that?
We're missing out, America. I mean, when, constipation is the number one gastrointestinal complaint of people in our country,
Wow.
and it's common in kids. So these issues start when we're very young, and then they persist into older age. And our diets, high processed foods, we have a lack of activity. We're maybe hydrating, but it may not be with the right types of liquids. Our colons are sluggish and slow, and that can lead to constipation. But when you have a bowel movement, and if it's not kind of the perfect consistency, it can lead to excessive wiping, and that can cause some skin irritation. Also, if you're a female on your menstrual cycle, it's really incredible to kind of rinse the area thoroughly instead of excessively wiping if you've got sensitive tissues. But also if you have hemorrhoids or fissures, which are common with constipation, it can be really irritating to wipe the area. So a bidet helps you clean the area. It helps you feel like everything's like you don't have to excessively wipe or use, wipes that have alcohols or chemicals in them. And so it's and it's good for the planet. So I'm a huge fan of bidets.
Nice. Okay, great. And yeah, it's interesting. Maybe TMI, but I hurt my back recently, and I was like in bed for like 4 days, and I was like, oh man, I'm not getting my daily bowel movement there.
Yeah.
It's crazy that when I just start, like nothing really changed. My diet stayed the same, but because I wasn't able to move around and do my normal activity, I wasn't having my normal movements, which was disappointing. But
Yeah. And it's uncomfortable. I mean, we all
yeah.
know, like, if you take a really great poop, you're like, I feel awesome, And so, but, there's side effects of medications. I think people who are taking weight loss drugs, antihistamines, pain medications, all of these have side effects. Even overactive bladder medications, they can cause constipation. And then we're layering on another medicine to treat that. So it's like, what can we do day to day that helps optimize our health so that we're not just kind of layering on things to treat symptoms, but really getting to the root cause of like what could be causing it and what could be helpful.
I'm a huge proponent of that. I was just telling people at dinner the other night, like anything you can do to avoid having to get on, prescription medication that could potentially cause a side effect, or obviously it's needed when it's needed, but if you can avoid it, and have those side, like you're saying, like frequent urination, once someone starts getting on a prescription drugs and they're on one for years for frequent urination, when it could have just been, they could have done a few, some simple exercises or some things, that you teach in your book and avoid that problem entirely. It's more of a holistic approach that we love to talk about on this podcast.
Yeah. And I think that, I practice in Western medicine. I think that there's a role of Eastern medicine as well. But I also think that our system, without going kind of too far down this rabbit hole, our medical system treats symptoms. We even do a test and then we're like, okay, take this. But I'm like, I always want to see like what caused that, right? Do you have a urinary tract infection because you're not emptying your bladder well? Do you have because your muscles are too tight? Do you have pelvic organ prolapse? Yes, because your pelvic floor is weak, but it's because you're straining with bowel movements and we need to work on constipation. So I'm always like, I want to put those puzzle pieces together. Absolutely, patients need medication. Absolutely, some need surgery. But what can we do to kind of optimize their health in the long run? And really, some of it comes down with just the basics of pelvic floor health that we've just never been taught.
Yeah. So we did talk about Kegels, and I know Kegels are not the be all and end all, but for people who are not that familiar with them, what are Kegels?
So the actual name came after a gynecologist, Arnold Kegel, in the 1970s, who ran a research project looking at the pelvic floor muscle strength of postpartum women, and that contraction of the vagina and the pelvic floor he called a Kegel after himself. So that's really where we got the name. However, a Kegel is a pelvic floor contraction. So your pelvic floor is a basket of muscles that sits at the bottom of your pelvis. So if we think of that kind of bony skeleton we see on, skeleton models and skeleton jammies, at the bottom of that is like a hammock or a basket of muscles. And that basket of muscles supports your pelvic organs, like we mentioned. It has the openings for bladder, bowel, and vaginal opening. And contracting that muscle is squeezing the sphincters and lifting up. So it's a squeeze and a lift of that basket. However, a lot of people don't know if they're doing it properly. Like you can't see this muscle. Like you can bend your elbow and see a bicep contract. This is really hard to do with the pelvic floor. So I actually go over kind of in my book different ways that you can see a contraction. So you can try urinating and you stop your stream. That's a Kegel contraction. Now, I don't want you doing Kegels every time you pee because you should be relaxing when you pee, not contracting. But it's a good way to be like, oh, that's a contraction. And then that's the exercise you want to do. You can use your hand, kind of place it over the area, the perineum, which is kind of between the scrotum and anus or between the vagina and anus, and squeeze and lift and feel that kind of lift away from your hand. You can take a mirror and you should see like the perineum draw up or the vagina close or even the penis and testicles draw up. Those are great ways to be like, oh, that's a contraction. And then make sure that you fully relax afterwards. You don't want to just walk around with that muscle tight. So that's what it is. It's for strengthening. It's great to do before a cough or a sneeze to prevent leakage. It's great to pull into core exercises to help kind of get the pelvic floor active in addition to the abdominal wall. You just need to make sure that you're relaxing it completely. Don't just like keep everything tight and sucked in. And then also make sure that you need Kegels, because not everybody needs to be doing Kegels. Some people need relaxation and some people are just fine.
Yeah, you mentioned that. So some people might need to relax and some people might need to strengthen, right? Maybe they're too tight and they need to relax, or maybe they're just weak and they need to strengthen. Is there a way that anyone would be able to figure that out without seeing a specialist, do you think?
Yeah, I have a quiz on my website, which is thevaginawhisperer.com. And there's a quiz that actually asks you a bunch of questions about like, what are your symptoms? What's your stage of life? What are you experiencing? And it kind of gives you like the most likely scenario. Like most people with tailbone pain, penile pain, vaginal pain, painful sex are going to have tension. Many people with leakage or prolapse are going to have weakness, but kind of going based off of what some of your other symptoms are. Say you also have constipation and painful sex, you're likely going to be in the tension category. So it's really kind of based off of symptoms. Also, you can evaluate yourself at home. You can have a therapist evaluate you. And then if you also try a strategy like I'm going to start doing Kegels and it makes your problem worse, that's not the right path for you. So then you kind of you don't want to do more Kegels. You're like, okay, I need to pause, redirect, and maybe I have tension I need to start working on.
Mm-hmm.
I think more people have tension than we realize. I would say in my clinic, it's 50-50. People are coming in with leakage and they're like, my pelvic floor is weak. I'm like, actually, it's too tight and it can't contract well when your bladder's under pressure. So we need to relax the muscles first with breathing, stretching, yoga, internal massage, and then work on the strengthening.
Interesting. Really, really interesting. So how frequently should people be doing Kegels, for example? Is that every
Well,
day?
if you have an issue,
Right.
so you don't need to be doing them every day. It's not like brushing your teeth. But I would say if you have an issue, we kind of follow the standard protocol for the American Academy of Sports Medicine, which is like 3 sets of 10, 3 times a week. But, it's not just about doing a pelvic floor or Kegel contraction like sitting in your chair. You really want to think about function. As we think about the role physical therapists play, it's getting people moving, it's getting them functional, it's getting them out of pain, it's improving their quality of life. So if you leak walking to the bathroom, well, doing Kegels sitting on your bed is not going to help you, right? You have to kind of build it into standing, into walking. If you leak when running, then again, you can't just do Kegels in the shower. You need to incorporate like hip strengthening, core strengthening, activation, breathing. So it's about kind of using the muscles during the times you need it to function and getting it stronger over time. And then it will start working for you. And then
Mm.
also stopping doing the things that could have potentially led to the weakness, like pushing when you pee, straining when you poop, things like that.
Yeah, and I've heard you say athletes, even younger athletes,
Oh,
this could be a
yeah.
common thing for. You would think that if the athletes would be stronger, maybe their lower body and their things would be stronger. So why would they potentially have a weak pelvic floor?
So, two reasons. One, a lot of the focus for athletes is on strengthening, and it's not about balance. There are
Mhm.
muscles that we're tightening, tightening, tightening. Everything we do mostly in fitness is like Pilates, core, bar, CrossFit. Everything is about tightening these muscles, but there's less focus on relaxation afterwards and balancing the muscle with stretching, breathing, yoga. We also live in a society that's high paced, high overactive nervous systems. We're sitting, we're constipated. So it's like we're not getting blood flow and movement to this part of our body like we need to be. And then the last thing is a lot of sports are high impact. So if you have a young woman who is a cheerleader, a gymnast, a basketball player, even a tennis player, a long distance runner, they're doing exercises that have a lot of impact down on their pelvic floor, but they're
Mm.
not focused on pelvic floor training. It could be relaxation, it could be strengthening, it could be both, but they're not getting the training for this muscle. So the activities they're doing are kind of overtaxing their pelvic floor muscles, and they need to start kind of pull back a little bit and get the pelvic floor training that they need. And it's just an overlooked part of female sports, to be honest. Like when I watch the Olympics and I see like, oh, they have an eye doctor there, they have an athletic trainer there, they have a physical therapist, I'm like, there needs to be a pelvic floor physio there, because a large majority of these athletes have pelvic floor problems and we're just not talking about them. It pulls them out of sport. it depend, they look at their wardrobes can be changed because they only want to wear a light color. They only want to wear a dark color to hide leakage. It's embarrassing. We don't know the behind the scenes stuff that people are dealing with because we don't talk about it. So my goal is really to kind of have these conversations to bring awareness that these things are happening and we need to start addressing them.
Yeah, this is really great. What else should people be thinking about? Maybe you in your own daily life, what are you doing that's different than the average person to ensure that you have good pelvic floor health?
So, I have two kids and I had two okay pregnancies. I can't say I love being pregnant. I was uncomfortable, but they weren't terrible. And I had two really wonderful births and amazing postpartum recoveries. And one of the reasons I started my Instagram account, The Vagina Whisperer, was because I was like, I have all of this information and I just happen to choose this field and it's helping me. Like everyone really deserves this information. And so that's kind of what led me to keep going on Instagram and then write this book. And I think some of the things that, when it comes to adding another thing on your list, it feels like I just don't have time or there's like too much to do. But some of these things that I do are really simple and easy to implement. And some of them we've already mentioned. So for peeing, I sit down to pee. I don't hover over a toilet unless it's really gross, which definitely happens. But I sit down because it helps my muscles relax. I don't push when I pee. So I call it power peeing. Sit and breathe and chill. When we push, when we pee, it can lead to incomplete bladder emptying and cause pelvic floor issues over time. And I don't pee just in case. So like I only pee when I have the urge to pee. I don't pee every time I leave the house or every time I get to Target or every time I leave my kid's school. It's like I wait until I have the urge to pee, unless I'm exercising or going to the gynecologist or something. But otherwise, I pee when I have the urge to pee. For pooping, squatty potty, I use it every day. Every bathroom in my house has it. When I'm traveling, I turn the trash can sideways in the hotel. I have a travel one I can put in the car when we travel. Like I am a squatty potty advocate, and I love a bidet as well. And I do take either magnesium or psyllium probably most nights of the week to help keep my bowel movement soft so I don't have constipation. I do pelvic floor strengthening. I'm perimenopausal and I hear so much great advice about building muscle strength, but we also need to build up our pelvic floor muscle strength because we lose 2% of our urethral muscle strength every year after menopause. So like I want that bucket to be full going into menopause so that I'm not like swimming upstream trying to catch up. And then I use a good lube during sex. No shame in that. And I use a vulvar moisturizer if there's any kind of vulvar dryness, which can happen like after breastfeeding or in perimenopause or postmenopause, or if you're taking hormonal birth control. So like, just being really proactive about like, these are the things I can be doing. But I've had pelvic floor problems. Like I've had pain with sex before. And I have this little device you can use. It's called a trigger point wand to like release a tight muscle internally. I started playing tennis a couple of years ago. And, right after I finished writing my book, I was at a tennis match and I made a quick movement and I felt myself leak a little bit. And I was like, oh gosh. And I was like, Sara, you're the vagina whisperer. You can't like wet your pants. Like this is off brand for you. But it showed me that like I'm aging, my hormones are changing. I'm trying a new sport, which is a new activity for my body. Like I have to train my muscles to meet the demand of what I'm asking my body to do. And so I had to kind of start doing more pelvic floor training and incorporate that into my workouts. So I think it's just being aware of like when an issue pops up, like you need to address it because it's likely not going to get better on its own.
Yeah. Yeah. This is really good stuff. So we talked about Kegels. We talked about squatty potty. We talked about not pushing too hard, trying to just relax when you're going to the bathroom. What else? I've heard you mention kind of breathing and yoga can be really good for it.
Yeah. So breathing, our pelvic floor muscles work synergistically with breathing.
Mhm.
And our pelvic floor muscles are at like the bottom of your pelvis. And then at the very top of your abdominal cavity is your diaphragm, which is your breathing muscle. So when you inhale, your diaphragm kind of flattens out and your pelvic floor relaxes. So if you have pelvic floor tension, just doing big, deep, like rib opening breaths can relax your pelvic floor. So think about when you're like really stressed out, you're like clenching your butt, you're holding your breath and you're breathing in like short, shallow breaths. Or if you're in a scary movie or something scary happens, which every time you watch the news, it's something scary. And you start like kind of clenching, and you don't take these big, deep breaths. And those big, deep breaths help relax your pelvic floor muscles. And it also helps quiet your sympathetic nervous system. So it's this kind of magical, thing that we can do that's free, it's accessible, and we're not using it enough. And then if you can kind of get the hang of this diaphragmatic breathing by opening and closing your ribs as you breathe, doing that throughout the day to maintain relaxation, you bring that into exercise. So you kind of inhale just to relax, and then you exhale to contract when you do a Kegel or pelvic floor contraction. And that's a great way to just start connecting with that muscle when you're starting a new pelvic floor routine.
So in terms of breathing, we're breathing through the nose, right?
Mm-hmm.
And expanding, kind of just expanding our stomach and even our chest, even our rib cage a little bit, but making sure we're not kind of breathing into the chest. We really want to expand that stomach, as unflattering as it may be, as much as possible, right?
Right. Well, so it's even less about the stomach. It's more about the ribs. So I tell people to kind of put their hands on their rib cage, like on the sides.
Mm-hmm.
And when you take a deep breath in and inhale, think about those ribs opening up like an umbrella. So you're not pushing your belly out. You're kind of opening your ribs, and
That's
you
different.
see how, it's like you're opening up like an umbrella, and then it's relaxing and closing. So it's not pushing that belly out.
Yeah, I'm used to doing belly breathing. I'm trying to
Right.
do it. It's like, it's actually not that easy to do it because I'm so used to doing belly breathing.
Yeah, and because we do so much core work that our ribs are kind of get like a little bit stuck. So it's like getting that diaphragm moving and open, our ribs expanding, helps the pelvic floor relax better. And I'm like, that in itself is so therapeutic in releasing pelvic floor tension. So when you're peeing, do your diaphragmatic breaths to help your pelvic floor muscles relax. When you're preparing for sex and you have a history of pain, do your diaphragmatic breaths to kind of help everything relax. After an intense core workout or, workout where you're doing a lot of strengthening, do the diaphragmatic breathing to help everything kind of loosen and relax down there. So it's a really easy thing to implement that everybody can do.
Interesting. Yeah. And you mentioned pain during sex. Is that like a pretty common thing, an issue?
It actually is quite common. So for females, 1 in 3 females will experience pelvic pain at some point in their lifetime. It's common with the first time we have sexual activity, which is not normal. Pain is not normal ever. It's especially not normal with sexual activity. And I think sometimes we think like, oh, maybe it hurts like the first time, or maybe it hurts like after having babies. But it's information from our bodies that something's not working the way it should. So starting to become sexually active after giving birth, when our estrogen levels may be lower and it causes vaginal dryness, or we've had a perineal tear or a C-section that can cause pelvic floor restriction. With aging, perimenopause and menopause, the tissues tend to tighten, and that can cause painful sex. And then anytime in a woman's life, I mean, there are studies that show that just watching something violent, not even sexually violent, can actually cause the pelvic floor muscles to become tense. So thinking about the world that we live in and the pace of life we live, like I get tension in my neck and shoulders and I get migraines and headaches. The same thing can happen to your pelvic floor and lead to pain with sex.
Wow. This has been amazing. Is there anything else that like any other kind of maybe something from your book or that people that you think people should know about that not enough people are talking about?
Yeah, I mean, I think there's 2 things. One, there's a lot of things that are coming out in the wellness industry that are focused on like vulvar hygiene and vulvar health and cleansers and washes. And, my number one takeaway is don't use anything that's scented, has chemicals or glitters or scents, or, you can rinse this part of your body with just water and it's fine. If you want to use a wash, make sure you use a pH balance specific vulvar wash. But, genitals don't need to smell like coconuts. Like it's fine to just use water. But I also want people to know that like there's no quick fix for these issues. You can't sit on a vibrating chair that does 30,000 Kegels. You can't just insert a laser wand for 3 months and expect long-term results. It's just like exercise. You have to put in the work, but the results pay off. This is long-term health for your body, and some really small changes you can make can go a really long way. The last thing I'll say is that it's never too late. I've treated women in their 60s, 70s, 80s, and they may have had problems for decades or just now experiencing problems, but it's never too late to get help. There's always things that we can do to help improve your quality of life and prevent these issues from getting worse.
This has been amazing. Dr. Reardon, where can people get your book, follow you on social media, all that kind of stuff?
So I'm on social media as the Vagina Whisperer on Instagram. It's the.vagina.whisper and the Vag Whisperer on TikTok. TikTok doesn't like the word vagina. So, and then my website is thevaginaWhisperer.com. I have tons of blog posts and exercises. I have a whole pelvic floor fitness platform that you can try for free for a week, just so you can kind of see what a pelvic floor workout looks like or get started on your journey. And my book, Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, is available wherever you like to buy books.
This has been great. And there's not a ton of episodes where it's like I'm learning tons of new information, but I can legitimately say that the large majority of what I learned today was brand new information that I have not learned before. And by the way, I've listened to thousands of hours of health podcasts and everything else as well. So thank you so much for spreading the message and sharing, your knowledge on this really important subject that many people are just either too embarrassed to talk about or just don't. So yeah, thank you so much for what you're doing. And I hope we can do it again sometime.
Thank you for having me.
Thank you. Thank you for listening. If you enjoyed this episode, it would really mean a lot to me if you would forward this episode along to any friends, family members, anyone that you think that would get value out of it and learn something important. The mission at Peak Performance is to help people prioritize and transform their health. And so if you think someone will get value, please, please, please do forward this episode along to them. Also, if you could please rate and review and subscribe on whatever podcast player you are listening to this on, we would greatly appreciate that as well. It means a lot. And I want to tell you about a couple of new products that we just released. You can get 20% off your first order at buypeakperformance.com. That's BUY peakperformance.com. We just released a brand new grass-fed beef protein isolate. This is my favorite new protein powder because it's great for muscle building and recovering and all that kind of stuff, but it doesn't give the stomach discomfort and gas that a lot of people get from different types of proteins like whey protein. Some types of plant proteins can do the same as well. It seems to be really, really easy on the stomach while still giving all the great benefits of muscle building and everything else that you want from taking in adequate protein. So check out our new beef protein isolate. We have it in unflavored, which I actually mix and blend with my morning coffee every morning. We have a vanilla and we have a chocolate. You can buy it on Amazon, but again, you also do get 20% off your first order at buypeakperformance.com, BUY peakperformance.com. We've also recently released organic mushroom coffee. We have these in Keurig compatible K-cup coffee pods. We have organic mushroom coffee with lion's mane, reishi, cordyceps, turkey tail, and chaga mushrooms blended with the high altitude organic coffee that we've been using and that we've been famous for years. So that's been a big hit, that one as well. You can get on our website or Amazon, any of our products. And of course, we're always famous for our organic green superfood powder that has almost 5,000 reviews on Amazon with a very high star rating. We're known as the best tasting USDA certified organic green superfood powder with over 25 plus organic ingredients. Again, we also have the organic red superfood powder. We still, of course, have the organic plant protein for those who do prefer the plant protein, but I'm really excited about this new beef protein isolate and all of our other products. We do have over 100 products, so just check us out if you type in Peak Performance Supplements on Amazon or if you go to buypeakperformance.com. Thank you so much, and we'll talk to you again soon.